when you go and really understand the dynamics of a community, they're complicated, they're challenging, and often, to better understand the community, the easiest place to start is ask the community. For us to achieve our mission of better understanding and advancing the health development and wellness of residents in SIU School of Medicine 66 County Service Region, we knew that we had to develop a department that worked on better understanding the region, understand their diseases that affected them, to design programs and policies that really thought through their culture, their political, social, and legal surroundings. And then in order to take that understanding, use that to build those programs and policies, we also had to sustain them by working through a political environment so we could transform public policy. And we launched as that Department of Population Science and Policy in July 2018, the first new academic medical department in the medical school in nearly 30 years.
Policy really drives the way the healthcare delivery system operates. And some of the issues that we've worked on with this department really delve into those areas, and talking to people in communities, bringing together partners and stakeholders from across the state, working with hospitals and nursing homes, and asking questions of communities, really sitting down and dialoguing about those social determinants of health. We know that healthcare means more than just a building. Healthcare is trying to make sure that all of the needs of an individual is met. Oftentimes in communities, transportation for many individuals is non-existent. Oftentimes they're food deserts. We're finding communities where there needs to be more grocery stores. In many instances, there may be specific provider types that are not in those communities, telehealth and telemedicine. And so really trying to bring an awareness of those issues, because our goal is to really reach into those communities and have an impact.
So during the early days of the department, we were selling an idea. How could a university partner with communities all across rural, central and southern Illinois to make an impact? And we were fortunate to have one of those conversations with Rex Brown, the president and CEO of Hillsborough Area Hospital. And Rex had the kind of notion and vision that we love to hear at PSP, to make Hillsborough healthier. And he knew the limits of what that meant from his hospital, but that there was more that the hospital could do in the communities themselves. And as a general pediatrician, the first idea that we wanted to start with was the children in Hillsborough, to give them an opportunity to better close that achievement gap. But Rex Brown had this idea that, well, we can't make it work in our smaller critical access hospital. But what we do have in the hospital is a child development center. And in that child development center, what we need to do is understand the gaps, but then also work with them to design those programs and solutions. And that idea just started to take life. People showed up, they started talking about it. We provided these little leaps bags because we wanted all children in Hillsborough to make that leap in their developmental outcomes. From there, it was, well, we can have this success with early childhood development. Can we also do it with lung cancer? Can we also do it with that of youth suicide? And our belief is that we will close those health disparities, and communities across Illinois will be healthier moving forward.
They're partners with us in making a difference in our community. I couldn't have done it, I don't think, without the school. I mean, that's clear, but the hospital board was just overjoyed that we had something going, that we could learn more about our community. Communication, the friendliness, the camaraderie is just very strong. We've had a delightful experience with them. They're the go-to.
So just like every new idea, we are still very much in the early stages of what population science and policy can do. But in order to make that happen, our department needs support. Support in terms of funding, in terms of policies that make this type of work actionable and more not an exception, but the rule. And so we would ask that community leaders, policymakers, take the work of our Population Science and Policy Department and make it something that is permanent and ultimately of the best use to improve the lives of individuals across the state of Illinois.